Well, thanks everyone for joining. I'm just going to quickly thank everyone for joining and introduce myself. My name is Christy Strauss, and I'm the Broker Sales Director at IAD. And wanted just to let everyone know is if you've joined us before, you do realize that you're in mute mode. And so there is a chat feature that you can type your questions, and we will get to those questions and answer them at the end of the webinar. And today we're happy to have with us HAP, Dustin Vandewine, who's the Director of New Business Sales at HAP. And we are going to talk about sales strategy and boosting your MA enrollments. And I don't want to give anything away, but it is centered around veterans and MA only plans. So Dustin, without further ado, if you want to go ahead and take it from there, if you have that capability. I think
Yep.
Oh, great. Okay.
I'm good to go. Can you see? Can everyone see my screen, or at least can you see it? Should be able to see it now. Hopefully. All right, I'm gonna get started. So thank you. This is Dustin Van Dyne with HAP. As Christy mentioned, I'm the Director of New Business Sales. I'm gonna be talking about veterans today. Pretty excited about this. I think it's a really good opportunity for agents, but also it's a really good opportunity for our veterans here in Michigan to help them understand what is available to them once they get to that 65 and are on Medicare mark. So we're gonna go through this. If you have questions, just type them in the chat, the Q&A. I have them up on my screen, so I will try to answer them as we go along. And this is a pretty quick presentation, so hopefully 30 minutes, we'll knock it out. So first off, let's talk about some statistics of the veteran community here in Michigan. So in Michigan, there's 530,000 veterans, okay? It's 6.8% of the population. United States, it's over 21 million. And then 54% over the age of 65 as of 2015. That's the most recent data I could find. So 2015, there's 54% of those people over 65. I checked a couple other stats out there, and it seemed like it was mostly around that 54% mark. So should be pretty accurate. And 7.4% of the veterans live in poverty here in Michigan. So hopefully those stats will kind of go into what we're going to be talking about today. So why veterans and what is the opportunity? So before I get into the plan, let's talk about the veteran market. So as you can see, based on these stats, there is a very large veteran community here in Michigan. You're talking almost 200,000 some people that are over the age 65, were a veteran served at some point in our country. And so what is this opportunity? Well, you know, back in the day when I started with HAP, is I used to hear all the agents talk about, hey, if I run into a person that's got VA coverage or other type of coverage, they would basically leave it alone and not touch it. And I don't know if that's the correct approach. So that's kind of what we're going to really talk about today, is how you can help them and not interfere with their other coverage. So what we're going to talk about is our MA only plan and why this makes sense for every single veteran pretty much that you run across. So let's get into this. Give me one second. So this is HAP's, what we call our veteran plan. It's a medical only plan. Why would you sell this to a veteran? Well, if you're talking to veterans, most veterans, and I'm going to say most, use the VA system, okay? And when they're using the VA system, they really, for the most part, don't have other insurance. They use the VA system. They have TRICARE. That's the big one out there. But they're happy with what they have. They don't understand anything else on the Medicare standpoint. A lot of them don't even pick up Part B for Medicare. But if you do run into a veteran that is on TRICARE that uses the VA system, why not sell them a medical only plan? So HAP introduced our medical only plan a few years ago, and we really generated this plan around working with veterans. They're the main people that make sense for this plan because they don't need the drug coverage. They already have it through either TRICARE or the VA benefits. So I sit down with a veteran. Veteran says, hey, I have Medicare A and B. I'm using the VA system. I'm happy with it. I don't want anything else. That is the perfect client that we want. So looking at this plan, why does this plan make sense? Well, when you're looking at medical only plans, there's not a lot of them out there in Michigan, We're one of probably the top ones here in Michigan. I know Humana has a big one that they sell a lot of. But if you look at the benefits, hands down, we beat them. So let's go through these benefits. First off, we give them a $50 a month Part B give back. That's $600 a year. So you sit down with a veteran, they don't need the medical coverage because they're using the VA system. They don't need the prescription coverage because they already have it. And they don't want anything else. If they have Medicare Part A and B, my first thing is don't enroll them into Medicare Part B just to sell them this plan. That won't make sense. But if they have A and B, you can get them this plan. They get $600 back a year on their Part B. The plan has no medical deductible, doesn't have a MOOP. Well, who cares about the MOOP anyways? They're not using the benefits. They're not using the medical. And what I tell agents is when you're talking about this plan, I really wouldn't even get into the medical side because then they're going to get confused. And we'll talk about that here in a second. Outpatient hospital, 200. ASC, I'll mention that in a second, 100. PCP, 0. Specialist, 20. Urgent care, ER, 90 and 65. So why would they use this plan? Well, so this is what I say. The veterans got the TRICARE. They have the VA coverage. They're using the VA system. What if, though, they wanted to go somewhere else? What are their options? Well, that's where this plan comes into place. They have other options. They can get PT, OT, ST outside of the VA system, and it costs them nothing. So maybe they don't want to drive to the VA hospital or a VA doctor because of how long it is. Well, they can use this plan. Here's the key, though. If you're selling this plan, the benefits do not coordinate at all. There's zero coordination between this Medicare Advantage, MA only, and their veteran benefits, their TRICARE benefits. So if they go to a doctor using this Medicare Advantage plan, and the doctor writes them a prescription, it ain't gonna work very well. So that's why I tell people when you're selling this plan, don't sell the medical. Sell it for the supplemental benefits, the Part B give back. Okay, so let's get into the supplemental benefits. What are they getting and what are you selling? So I sit down with a veteran, again, has A and B, TRICARE, says they don't need anything else. I say, if I get you a plan that costs you nothing, plus gives you $600 a year back on your Part B, would you like a free gym membership? You can go to LA Fitness lifetime at no cost. You can get $75 a quarter for over-the-counter benefits to use for vitamins or whatever else, allergy medicine, which I need. You also get your preventative dental. You can get 2 cleanings per year, an exam at no cost with Delta Dental. And then we also have a lot of other benefits with this plan. So you could sell that all day long. So we have an agent, and Jason and I were talking about this last night, and Jason's on here too. He's our Medicare consultant for HAP. We were talking about this yesterday. We have an agent that wrote 16 apps for the month of July. Now, a lot of agents say, how does an agent outside of AEP and OEP write 16 apps? Let me tell you, all of them were veterans. 16 apps, all veterans in 1 month. All for July 1st effective date. So we're talking pretty good business. So how does he do it? And he does this every single month. Well, he works very, very closely with the veterans community. And what he's figured out is most veterans do have A and B, but they have TRICARE and VA coverage. And what he's selling is those supplemental benefits. He doesn't even get in the medical. And he literally tells them, don't use the medical, because it's going to cause you issues from your VA coverage. Don't pay attention to it. If you have to use it, it's there. If you have to use the ER, it's there, but you can't get prescriptions ordered. So kind of stay away from that. Sell the dental, the vision, the hearing, the gym membership, the over-the-counter. So now let's talk about how he wrote 16 apps outside of AEP and OEP for people that already have A and B. I'm going to skip this because we can come back to that. So we're going to have to talk about enrollment periods. So what do veterans get that's different than everyone else when it comes to enrollment periods? Well, they have the ICEP, everyone does, A and B, new to Medicare, A and B, you get your 7-month window. You have your AEP, you have your OEP, you have your SEPs just like everyone else, change of address, eligible for Medicaid, LIS. But the big one for veterans is dropping Part D, D as in dog, coverage. So how is this agent writing so many apps? Well, what he's finding is when he's sitting down with a lot of these veterans, at some point along their life, I mean, they're over 65, someone sold them a PDP or an MAPD. Okay, so someone sold these people a PDP or an MAPD at some point. And he finds that they're not using it. They're not using the medical, they're not using the prescriptions because they're using the VA system. So what he does is he talks to them and converts them to an MA only plan. The question is, how do you do that outside of OEP or AEP? A veteran can drop the drug coverage at any time and enroll in an MA only plan. So every single veteran you run across, if they have an MAPD or PDP, you can move them into an MA only plan any time of the year. You are using loss of Part D coverage. That is an SEP, and we're one of the few carriers that does this because not a lot of carriers have an MA only plan. This one agent, 16 apps, 1 month. How is he finding these people? So his marketing is he works very closely with the VA hospitals and the different community events. There is veteran events all over the place, and he gets involved in every single one of them. He also goes to all the different veteran associations and markets himself that he can add value. He shows them how he can give them $600 back a year, and it doesn't cost them anything. That's how he writes business outside of AAP. A lot of agents have found that, during AEP and OEP, you can write a lot of business. Once you get outside of that, finding T65, which everyone wants to go after, it's hard to find those people, even though there's 10,000, probably almost 11,000 a month in Michigan that are turning 65. So you got to start thinking outside the box. Here's a market that's untapped. No one's really working this veteran market. Now, obviously, I've done a lot of these webinars, so people are starting to work with the veteran market, and we're seeing a lot of people, try getting grants for different veterans associations. I heard from one agent that he was able to stand at a, I forgot what place it was, but right outside their office, and he was able to set up a booth because he gave them $100 charitable donation, and they let him put up a booth right outside their office. And as people came in, he talked to them. So this is a huge opportunity for agents. Not only are you helping veterans, okay, that are underserved in this area, but also it's a market you can sell all year round. We actually had a veteran, this is probably about 3 or 4 months ago, and we're working on getting the letter published because I think it's extremely important. And this veteran actually found our CEO's email address, Dr. Genord, and emailed Dr. Genord, and basically wrote this long email about how happy he was that HAP had a plan like this that would give him money back a year and he didn't have to pay anything for it. And he talks about in the letter how every single veteran should be made aware of this, how they all should buy this because it cost him $0 and he's getting $600 back a year, plus he's able to get all these other extras. So I think from our standpoint and why we're doing all these webinars is this is a huge opportunity. From an agent standpoint, 200-some thousand people that are over the age of 65 that are veterans that most agents have never talked to. And I would find that a large majority of these veterans are probably in the east side of Michigan. So very good opportunity for you as agents. The other things I didn't mention that I want to just real quick go through here and important, because I think while I have your attention, I'm just going to point out some things that we're seeing in the market, not just veterans, but we're seeing in the market. So one thing I want to point out is ASCs. How many of you are familiar with ASCs? Can't really hear, so I'm going to assume that some of you are and some of you aren't. So ASCs, ambulatory service centers. What are ambulatory service centers? Ambulatory service centers basically are starting to do all of the outpatient hospital surgeries. Okay, so you have someone that needs a knee replacement. They need, I don't know, any type of minor outpatient surgery. They're starting to be done in ASCs. If you Google ASCs, you'll find they're all over the place. Most people are just not sure what they are. So we have found this year that ASCs have been really getting pushed by providers because it's a way lower cost of for health insurance, but also from the medical standpoint, it's a way lower cost. So as the industry tries to drive down cost, ASCs are going to become a lot more common. So HAP has really started specializing in this, and you're going to see a lot happening with this in 2022. So I'm trying to get our agents ahead of the curve and really understand the ASCs and why, from an agent standpoint, you guys really should educate your clients on ASCs and say, hey, whenever you're talking to a specialist, if they recommend you for an outpatient surgery, tell them you want to go to an ASC, ambulatory service center. Our ASC copay on this is $100. Our ASC copay on most plans, $125. Guess what our competitors are? $300 in most cases. What does that tell you? Well, first, if you have anyone that ever is going to need an outpatient surgery, they should be buying HAP. because we're 100 compared to 300. We're a third of the cost. Why are we a third of the cost? Well, we're ahead of the curve on this. We had someone we hired about a year ago that's really figured out what's happening in the Michigan market and how these ASCs are growing, and really started pitching this to all the local providers with the health with Henry Ford. So this is a really good opportunity for you as agents to get ahead of the curve, educate your clients on how they can basically, in this case, save 50% on the outpatient copay. And long term, it's going to drive down the cost from an insurance stand and from a medical standpoint. Plus, it's easy to sell HAP when we're a third of the cost of everyone else. The other thing I wanted to point out here that we're seeing in the industry, and hopefully this will get you ready for 2022. We are very excited about 2022 with our plans coming out. Our certification, it's going to launch next week sometime if I decide to hit the email button to send it out to you guys. But 2022 plans will be out, all the details next week on the 6th, I think it is. But one thing I want to talk to you about, and another thing and why it's important for the veterans community, is dental insurance. So one thing we hear in with talking to the veterans and with the agents that are writing a lot of these apps for the veterans is a lot of them need dental insurance. Now, I mentioned it's got the preventative cleaning. I highly recommend talking to them about for, hey, $40 a month, you can get an extra $1,500 of dental coverage. It makes sense for them. I think it's a great benefit for them. So that's something I want to bring up. Now, what is happening for dental insurance? I'm sure you're aware of it. A lot going on. I'm sure you've run into it. So dental this past year for AAP was the #1 reason people changed Medicare Advantage plans was dental insurance. Guess what the #1 reason during OEP was? Dental insurance. The funny thing is we found out that they were actually going from the plan they left during AAP going to a new plan. I'm not going to mention the name of the company. And then during OEP, they're actually switching back to that original plan. Why is that? Well, dental insurance is becoming the #1 reason why consumers are buying Medicare Advantage plans, but also switching. And what's happening is they go to buy the plan and then they realize it's not what they thought. And I think a lot of it comes down to the brokers understanding exactly what is included. So one thing I'm going to tell you, especially for 2022, the best advice I can give you, if you're talking to a consumer about dental insurance, including the Medicare Advantage, please read the EOC. What we found is that this carrier, 2 carriers that agents were selling, if you read their EOC, in the EOC, it says that they only cover 1 filling a year, root canal every 3 years, a crown every 5 years. And it's a reimbursement. Why would they limit that? So people were really shocked when they went to go use this insurance, and that's when they found out. They also found out that, hey, there's no network. So if you don't have a network, what happens on medical is these doctors will be willing to take a discounted amount because they're afraid of not getting paid at all. So they'll actually take a 50% cut, and it's a lot less. So consumers are saying, hey, I'm just going to pay out of pocket for my doctor's visits. Sometimes that's not a bad thing. Dental doesn't work like that. The dentists really don't need the consumers. They also have really, really good contracts with companies like Delta Dental, and they don't want to lose those contracts. And in the contracts with Delta Dental, it basically says that we will be your lowest cost payment, and we're going to have a 20% discount below anyone else, even cash pays patients. So what's happening is these companies that are doing the reimbursements, they're finding that, hey, a normal preventative cleaning is going to cost $100. But since you're a cash patient and you're getting reimbursed, we're going to charge you $250. So these people are getting these reimbursements are finding it's not going very far. So going into 2022, if you're talking dental insurance, not only just for veterans, read the EOC, be very careful selling reimbursements. And secondly, make sure the network is very strong. One of our competitors has a pretty rich dental plan. They're blue is the color. And we found out that their dental plan is paying 72% of the claims out of network. How many of you are aware of that? 72% of the claims are being paid out of the network on the dental benefit. So be careful on that side. As dental continues to be the #1 reason people buy Medicare Advantage plans and switch Medicare Advantage plans, consumers really need to understand exactly what they're buying. So I just wanted to give you a heads up on that. But going back to veterans, they also get the vision. Another thing that's extremely important we're finding in the veterans community is the vision. And then you got the hearing, the over-the-counter. Now, if I was an agent, going back to the marketing standpoint, and I mentioned setting up booths at the different VA associations, going to any event that is, or not VA associations, veteran associations, but going to any event that is kind of catering towards veterans or seniors that are veterans, I highly recommend as agents get involved. See if you can have a table. From a HAP standpoint, I have no problem doing co-op dollars with you as an agent. So if you say, hey, you know what, we have this event coming up, I'm a new agent, or I just can't see making an investment, it's $500 to have a table, reach out to IED. They can reach out to me. We can see if we can do a co-op marketing of some sort to help you with that table. We want to be involved in this community, and we know what the opportunity is because it's very underserved. The other thing is, from a marketing standpoint, we have flyers. So if you haven't seen our veteran flyers, they're all over the place. Jason Gletzner is on here. You can email him. He can send you a copy of one of the flyer. But again, don't market the medical. That's not what they want. If you market the medical, you're not going to sell it. Sell the supplemental, the gym membership, the dental, the vision, the hearing, the $600 back a year, and they don't have to pay anything for that. The other advice I give you, if they don't have Part B, and they're happy with what they have, don't make them sign up for Part B just so you can sell them a HAP Medicare Advantage plan. Please don't do that. I don't want HAP getting ripped on in the news because all these agents start forcing veterans to get Part B to pick up the plan. It's not going to make sense. But we do find, and what I found talking to this agent and talking to Jason yesterday, is a lot of veterans, they've already enrolled in a plan thinking they have to. They picked up A and B thinking they have to. And even though they have TRICARE or VA coverage, they also enrolled in a Medicare Advantage or PDP. We find a lot of them have a PDP plan for some reason. Maybe they're using drugs outside of the VA system, which could be the reason. But in most cases, if they're using the VA system, they have to get their drugs through the VA system and they don't need the PDP. So again, they can drop the PDP or an MAPD any time of the year, roll in an MA plan. So huge opportunity for you as agents. I don't think we also do the mom's meals, Livongo. Everyone knows that stuff. Hopefully, I know this was very quick. I don't see any questions. I will stay on here for a couple minutes just to see if there are any questions. But again, we want to work with you as agents. So if you have any ideas or things that you want to do for the veteran community, I know from a HAP standpoint, we are starting to do a lot of events. We have a Veterans Appreciation Day coming up here. I think in the next month we're hosting. But even we had an agent that told me that they worked with a middle school and we're doing cards to veterans. So they're just going to send out cards, and they had all the elementary students basically write their name and write something on a card to a veteran, and they said they had a lot of success with that. So anything like that, but we're willing to help you. Just reach out to us, let Jason know, let me know. We want to market with you. So if you have ideas, just reach out, and I hope this quick presentation helped you, and have a great 4th of July weekend. Thank you.
Thanks so much, Dustin. We appreciate your time. Any questions? If not, feel free to give me a call. I can be reached at the IAD phone number. You can reach me at the toll-free number, 800-381-0977. I'm at extension 108. Thanks so much for your time. You all have a really wonderful 4th of July holiday. Thanks.